Welcome to 50% off all dermal fillers. Dermal fillers are substances that are injected into the skin to replace lost volume. Typically, lost volume comes from aging. Some types of fillers we use in the office include RESTYLANE JUVEDERM PERLANE, Radius, Sculptra, and two new exciting fillers, Volatero and Stylish with mannitol. The general FDA indication for dermal fillers are lines around the mouth, but they also are used in the cheeks, lips, teardrops, marionette lines, temples, chest, forehead, ears, hands, and other locations. In general, filler injections have no downtime, and the results are seen immediately after injections. The recent addition of lidocaine in some fillers make the injections more comfortable. Other ways of making the patient comfortable include nerve blocks and topical anesthetics. Hyaluronic acid fillers such as Juvederm, RESTYLANE, and Perlane are popular because not only do they show immediate results, but they can also be dissolved should a complication arise. When having a dermal filler injection, it is important to evaluate the whole face. If you concentrate the filler in one area, it may make the face look unnatural. Therefore, it is important to have a filler injection by an experienced injector. As we age, our temples become hollow, our cheeks become sunken, and our chins become less prominent. Replacing lost bone and fat with filler substance can create a more youthful contour to the face. Fillers are used in patients of all ages. For younger patients, the focus is on augmentation, such as lip augmentation. Fillers can also be used to help the contour of acne scars, as well as improve the contour of a patient's profile. When a filler is injected into the nose, it can change the shape of the nose, making it more aesthetically appealing. For older patients, the focus of fillers is on correction and restoration of lost volume from aging. Patients of all ages can benefit from the scientific advances in filling agents, which allow for comfortable, safe volume replacement or augmentation. Now, with this exciting information, we can offer this at half the cost of any med spa or doctor's office. What an exciting opportunity to come in and have a consultation and set up an appointment. The phone number is on the opening picture with our card and information. Thank you, and I hope to hear from you soon. In this picture, it is the before picture. We will be doing the teardrop and we'll be doing the nasal folds. Shortly, you will see the after picture of what it looks like after using the dermal fillers. Now here is the after picture. We have used the dermal filler in the teardrop and we've used it in the nasal folds. You can see how evenly this filled in those areas and what a wonderful look. She looks very refreshed and very youthful. Now on this picture on the left hand side, you can see a woman with large bags under her eyes and very deep teardrops. She has a very tired look to her face. Now on the right hand side, you can see what can be accomplished with adding the dermal filler in the teardrop areas. You can see her skin is smooth. She looks refreshed and radiant. Now in this picture on the left hand side, you can see a young gentleman who had been scarred and pitted from acne. On the right hand side, you can see the results of adding the dermal filler. We created the fullness, we removed the pitting and scarring, and the face looks firm and natural and smooth. What a wonderful result. Now on this picture on the left, you can see the woman's nose has a slight indentation towards the end of the nose and right at the bridge of the nose. This doesn't lead for a very attractive profile. But now on the right, you can see the correction that we could do with dermal filler. We have filled in the lower area and a little on the bridge of the nose, and what a wonderful straight, nice line. Really enhances the profile. What a great result. Now here we're going to take a look at forehead wrinkles. Obviously on the left hand side, the woman is the before picture of forehead wrinkles, and on the right hand side is after our dermal filler injections. What a nice smooth result. Now here you see the gentleman on the left has a lot of hollowing in his lower cheeks and a lot of hollowing in the nasal fold. Now on the right hand side, you can see we augmented with a dermal filler the lower cheek and also filled in his nasal fold area. This is a terrific result. Now this procedure is not only for women, it has wonderful results for men as well. Now on this picture to the left is a nose that has been indented on the lower part of the nose. This is pre-injection. Now in the middle is immediately after an injection with a dermal filler, where we were able to even out all of that area and fill in. And to the far right is 1 week after post-injection, and you can see how that area has filled in very nicely. The nose has a nice, straight, defined look. This is a great result, and you can see the difference that we can make in using this simple procedure and filling in the area of the nose. Now here's a picture of a lip augmentation with dermal filler. The before is on the left, and you can see that she has some wrinkling and soft folded tissue on the upper lip, which is a little imbalanced with the bottom lip. Now on the right hand side, you can see the subtle change. We used a dermal filler to fill in the upper lip. We added volume and removed the wrinkles. The lip is perfectly balanced. This is a perfect result. Now on the left, you can see this woman has a very receding chin. It's not complementary to the profile. It looks unbalanced. On the right hand side, what a tremendous improvement with a chin augmentation done by dermal fillers. You can see her profile is perfectly balanced. This is a great result. Now here we have a before picture on the left hand side, where the upper lip is a little hollow on the inner part of the lip and not a lot of definition on the vermilion border. On the right hand side, this is an after picture. What we did is we increased the volume on the inner part of the upper lip, and we also inserted the dermal filler on the vermilion line to give a little more definition and that added volume to balance both upper lip and lower lip. This is a nice result for someone who wants really full lips. Now on this picture we have a before and after of a woman's hand. You can see as we age, you can lose your fat volume on the top part of your hand. It also allows the veins to be very visible. This is a very definite sign of aging. Now on the lower hand, the after picture, we added a dermal filler. We filled in those areas. We minimized the visual look of the veins, and we also smoothed out and plumped out that area of the hand. It's a very nice result for an aging hand. On the picture on the left, you can see the before picture. There's a hollowing and shadowing under the teardrop. There's a depression on the nasal folds. And then also under the bottom lip you can see the loss of fat volume on the sides of the chin. Now on the after picture you can see where the teardrops were done, the nasal folds were done, the sides of the chin were done under the bottom lip, and then a small augmentation done to the lips. Now this leaves her with a nice, smooth, full, radiant look. Hello, welcome to 50% off all derma fillers. I would like to tell you a little about our two new products. Our first product is Stylage, and Stylage is the first monophasic antioxidant cross-link hydrolonic acid based gel, completely biodegradable, of non-animal origin, specifically designed for the natural correction of superficial lines and wrinkles. The presence of mannitol, the free radical scavenger, limits the devastating effects of free radicals on the dermis and product injected, thus reducing the risk of post-injection inflammation and preventing the gel structure dehydration. Now another product that we are going to be offering is Bolotero Balance. Bolotero Balance is a monophasic hydrolonic acid based gel derma filler that differs from other hydrolonic acid fillers by incorporating a cohesive polydensified matrix technology, making it the first derma filler of its kind in the world. This product was first launched in Germany and is now widely used as an injectable derma filler to correct moderate to severe facial folds and wrinkles. Now, how does Bolotero work? Well, hydrolonic acid-based derma fillers provide wrinkle reduction and plumping by introducing this natural sugar through injection into the dermis. Hydrolonic acid is a natural substance that is present in the human body and can diminish over time due to lifestyle, pollution, sun damage, and aging. When injected into treatment areas, this derma filler attracts water to the site, encouraging natural plumping to occur. Now, some of the advantages of Bolotero is, as the first hydrolonic acid derma filler that is monophasic and includes cohesive polydensified matrix technology, Bolotero offers several advantages, including increased elasticity and viscosity, allowing for natural smooth integration, long-lasting effects that are immediately noticeable, minimal discomfort during injection, anticipated cost-effectiveness, and a high level of purity, providing increased safety. Now, if you're interested in these two products, our card and phone number is at the beginning and the end of this video. Feel free to call for an appointment for a consultation. I hope to hear from you soon, and thank you.